Today, I'm going to talk about my clinical trial of the MRgFUS BBB disruptions in patients with Alzheimer's disease. We recently underwent the safety and feasibility test of the BBB opening for patients with glioblastoma, and we opened the 1 cubic centimeter size of the BBB opening adjacent to the tumor resective margin like this. We opened the BBB 6 times during the standard stop protocol, and we didn't see any complication. And we usually open the 5 or 6 sites adjacent to the tumor resective margin at about 1 cubic centimeter. And among 6 patients, 2 patients showed recurrence, but so far the other patients showed a stable benefit with this treatment. We all know that the BBB opening can apply for the Alzheimer's disease. This is our animal experiments for rat model of Alzheimer's disease. And this first treatment itself can improve and enhance hippocampal neurogenesis. And also we can deliver the more cell into the hippocampus with this technique. Interestingly, we also confirmed the first treatment can reduce the amount of the amyloid plaque in the hippocampus. For this clinical trial, this is our inclusion criteria. We underwent the FDG and the FBB PET to confirm the change of the amyloid plaque and the brain function. And also we underwent a comprehensive neurocognitive evaluation test for this clinical trial. When we designed this one, we are trying to open the BBB twice with a 3-month interval, and we only plan to open the BBB twice. It's because of the feasibility and safety studies. We just want to confirm, and also because of the regulation of the Korean FDA, we couldn't use the amyloid and FDG PET so often. So we want to make interval to evaluate the functional brain with PET with this long-term clinical trial. Main difference my technique is we just want to open the BBB very widely in the frontal lobe bilaterally. As you can see, we just open bottom and middle and upper part of the frontal lobe like this. Of course, we just want to open the BBB in the white and gray matter junction, that which we suspect to have more accumulation of the amyloid. I just want to show one cases. This is the 84 years lady. MMS score was 21, and the patient showed the accumulation of the amyloid plaque in the whole brain, and also the patient showed the decreased FDG uptakes in the brain. This is the FBB and the FDG PET before treatment. As I mentioned, we opened very wide area in the frontal lobe bilaterally. You can see the BBB opening in the bottom and middle and upper part of the frontal lobe with gadolinium enhancement. This is our analysis of this amyloid PET. As you can see, after the BBB opening, there's a clear decrease amount of the amyloid plaque in the amyloid PET. We couldn't analyze all the data yet. Probably end of this year or early of next year, we could analyze all the data. This is our initial 3 cases. As you can see, attention, language, and the spatial function, as well as the neuropsychiatric function seemed to be improved a little bit, but we don't know the result yet. At this moment, we don't know the real benefit of these procedures, but if we combine this technique with cell or drugs, we believe that we may have chance to find the new technique to treat patients with Alzheimer's disease in the future. This is my team, and I hope all of you can join for our World Society meeting year 2022. Thank you.